This segment of Showcase is brought to you by Secours. I am here with Dr. Budny, who is an orthopedic surgeon. I have so many questions for you, by the way, because I think that sometimes as we get older, we start thinking about, do we need a doctor? Am I just old and this is just what happens to your body? How do we know when we need to see an orthopedic surgeon?
So it's a complicated question, ultimately what it comes down to is tolerance. What we're really trying to do is preserve quality of life. Really in the end, it's a matter of what do you want to do and what are you able to do. And ultimately, I think we all wind up ignoring some of our problems for probably a little bit too long. I get a lot of people who say, that, well, I waited the month, I waited the 6 weeks, whatever it is. And there's not really a hard time frame. Really what it comes down to is if you're not able to do the things that you want to do, and it's been reasonable, it's not like go call a surgeon one day into having an ache or a pain,
right.
But ultimately what it comes down to is if you can't do the things you want to do over a reasonable amount of time, then it's time to call somebody.
I've always wanted to be professional athletes, but I'm not going to call you for that because I know that's just not going to be in my wheelhouse. But as far as like people who were athletes earlier on in life or maybe still do a lot of physical activity, do you feel like those are people that really need your services more?
It's an interesting question. Sometimes yes, sometimes no. Really, I find that population, the active, maybe weekend warrior type of person, I'm guilty of that too. Sometimes they do, and really, it really goes back to the same thing. It's are you able to continue those athletic activities to the degree that a reasonable person would?
At your age, the degree that someone at your age, I think, is an important disclaimer.
I wasn't saying that about you, but ultimately it is in general. Yes, it's very important to keep a realistic eye on what you can do because I can't do what I did 20 years ago, and I make that comment to a lot of my patients. And so what it is realistic expectations about what your body can and should do. And if you're not able to do that or perform to the degree that you think is reasonable, then yeah, I think it's time to talk to somebody.
I think it's always really interesting to learn about the changes in technology, even in the last couple years, the last decade. Tell us about some of the breakthrough technologies that you guys have here at Secours that you're working with.
Yeah, so it's really an exciting time in medicine. I think we're more than capable of doing an awful lot of really neat things for patients and really preserving joints. This is going back to your question about whether maybe athletes in their past are having some troubles with their joints. We're able now to really extend out a lot of the joint preservation things. So we're doing a lot of regenerative medicine. And then if it ever came down to not being able to preserve a joint, but even replace a joint, there's things like robotic arm assisted surgery or injections that maybe were not available before, or even modalities that can help to preserve pain without any need for surgical intervention.
Do you think that there is a misconception that anyone who comes to see you is like, you're going under the knife, immediately surgery? Like, what is the biggest misconception that you see for patients who are coming to you?
Yeah, I think honestly, there's the internet, right? And we all worry about the internet a little bit. Everyone talks to me about their Dr. Google, and they always say it a little bit tongue-in-cheek. They always say, well, gosh, I looked this up.
But there's a seed of truth in the way that people are doing that, right?
Yeah, absolutely, yeah. And so in the end, I think the biggest challenge for me is with these preconceived notions, which is perfectly fine. I think most of my job is to educate people. And in the end, I can do the technical job of medicine and I can do the technical job of surgery. But I think most people are just coming in looking for answers. And one of the bigger challenges is those preconceived notions.
Yeah, it's a journey to go through all of this. It's not just you come in immediately have the answer, right?
Mm-hmm. Yeah, absolutely.
Yeah, this has been fascinating to learn about because I really didn't know that there were all these different types of options. And also, I'll admit it, I'm a Googler for sometimes for things. But don't do that. Come in instead and learn all about the different options that you have. Dr. Budny is amazing here if you need an orthopedic surgeon. And there's so many fantastic doctors and medical experts here at Secours. So you can go online, you can find out more. There's all kinds of different programs that they use and different opportunities to take care of yourself. That's what it is all about. So thank you so much, Dr. Budny. We appreciate it very much. This segment of Showcase is brought to you by Secours.